Welcome back. Today, we're tackling the hardest NCLEX questions of 2026. Are you ready to test your limits? A client receiving a continuous IV heparin infusion develops petechiae and hematuria. Which laboratory result best confirms the nurse's suspicion of a heparin-related bleeding complication? Correct answer is B. Prolonged activated partial thromboplastin time. Rationale: heparin therapy is monitored using APTT. Excessive anticoagulation leads to prolonged APTT and bleeding manifestations such as petechiae and hematuria. A decreasing platelet count would suggest HIT, which is a different complication. The nurse receives report on 4 clients. Which client should be assessed first? Correct answer is A. Client with asthma who is using accessory muscles to breathe. Rationale: use of accessory muscles signals impending respiratory failure, making this an immediate airway and breathing priority. Hypoglycemia without symptoms and fever require intervention but are secondary to compromised ventilation. A client with acute kidney injury has a serum potassium level of 6.8 milliequivalents per liter. An ECG changes. The provider prescribes IV regular insulin with dextrose. What is the primary therapeutic purpose of administering insulin in this situation? Correct answer is C. Drive potassium from the extracellular space into the cells. Rationale: insulin stimulates cellular uptake of potassium by activating the sodium-potassium pump, temporarily lowering serum potassium levels. Calcium gluconate stabilizes cardiac membranes, while diuretics and dialysis remove potassium from the body. A malnourished client with a long history of alcohol use disorder presents with confusion, unsteady gait, and ophthalmoplegia. Which medication should the nurse administer first? Correct answer is B. IV thiamine. Rationale: these symptoms indicate Wernicke's encephalopathy, caused by thiamine deficiency. Thiamine must be given before glucose to prevent irreversible neurologic damage. Administering glucose first rapidly depletes remaining thiamine stores and worsens encephalopathy. A nurse assesses a client 4 hours after abdominal surgery and notes sudden hypotension, tachycardia, pallor, and abdominal rigidity. Which complication should the nurse suspect first? Correct answer is B. Internal hemorrhage. Rationale: hemodynamic instability combined with abdominal rigidity indicates possible internal bleeding and evolving hypovolemic shock, a life-threatening postoperative complication requiring immediate intervention. A client with myasthenia gravis develops worsening muscle weakness and respiratory distress. Which assessment finding most strongly suggests a cholinergic crisis rather than a myasthenic crisis? Correct answer is C. Excessive salivation and diarrhea. Rationale: cholinergic crisis results from excess acetylcholine and presents with muscarinic symptoms, excessive salivation, diarrhea, abdominal cramping, bradycardia, and sweating. Muscle weakness and respiratory distress occur in both crises, making secretions the key differentiator. A client with a history of moderate persistent asthma is admitted for hypertension. Which newly prescribed medication should the nurse question immediately? Correct answer is B. Propranolol 40 mg PO twice daily. Rationale: propranolol is a non-selective beta blocker that blocks both beta and beta-2 receptors, leading to bronchoconstriction and potential life-threatening asthma exacerbation. Cardioselective beta blockers like metoprolol are used cautiously, but non-selective agents are contraindicated. Which hospitalized client is at the greatest risk for developing disseminated intravascular coagulation? Correct answer is B. Client with septic shock requiring vasopressors. Rationale. Severe sepsis and septic shock cause systemic inflammation and massive activation of the clotting cascade, leading to microthrombi formation and consumption of clotting factors, hallmark features of DIC. Chronic conditions without acute systemic inflammation carry a much lower risk. A trauma client suddenly develops severe respiratory distress. The nurse notes absent breath sounds on the right, jugular vein distension, hypotension, and tracheal deviation to the left. What condition does the nurse suspect? Correct answer is C. Tension pneumothorax. Rationale. Tension pneumothorax occurs when trapped air increases intrathoracic pressure, causing lung collapse, mediastinal shift, impaired venous return, hypotension, and JVD. This is a medical emergency requiring immediate decompression. A client with septic shock has received 30 milliliters per kilogram of IV crystalloids but remains hypotensive with a MAP of 58 millimeters of mercury. Which medication should the nurse anticipate administering next? Correct answer is B. IV dopamine infusion. Rationale. In septic shock, persistent hypotension after adequate fluid resuscitation indicates the need for vasopressors to maintain a MAP greater than or equal to 65 mm of mercury and ensure organ perfusion. Dopamine increases systemic vascular resistance and cardiac output. Diuretics, beta blockers, and digoxin worsen hypotension in shock. A client with acute kidney injury has a serum potassium of 6.9 milliequivalents per liter and an ECG showing tall, peak T waves. Which provider order should the nurse implement first? Correct answer is A. Administer IV calcium gluconate. Rationale. Life-threatening hyperkalemia requires immediate cardiac membrane stabilization. Calcium gluconate does not lower potassium levels but prevents lethal dysrhythmias. Other therapies reduce potassium levels but are secondary once the heart is stabilized. A nurse is monitoring a client following a traumatic brain injury. Which assessment finding most strongly suggests worsening intracranial pressure? Correct answer is C. Unequal pupils with projectile vomiting. Rationale. Unequal pupils indicate cranial nerve compression, and projectile vomiting reflects increased pressure on the vomiting center. Together, these are classic signs of increasing ICP and impending brain herniation. A client is receiving IV insulin and fluids for diabetic ketoacidosis. Which laboratory change best indicates that the treatment regimen is effective? Correct answer is C. Increasing serum bicarbonate level. Rationale. DKA causes metabolic acidosis due to ketone accumulation. Effective treatment is reflected by resolution of acidosis, shown by a rising bicarbonate level. Potassium changes require careful monitoring, but correction of acidosis is the key indicator of improvement. A client with a complete spinal cord injury at T4 suddenly reports a pounding headache and anxiety. The nurse notes a blood pressure of 210/110 mmHg, heart rate 48 bpm, facial flushing, and diaphoresis. Which assessment finding best confirms the nurse's suspicion of autonomic dysreflexia? Correct answer is B. Bradycardia associated with severe headache. Rationale. Autonomic dysreflexia occurs in clients with injuries above T6 and is triggered by noxious stimuli below the level of injury, most commonly bladder or bowel distension. It causes massive sympathetic discharge, resulting in severe hypertension, pounding headache, and reflex bradycardia. Flushing and diaphoresis occur above the level of injury, making this a medical emergency due to risk of stroke or seizure. A nurse is assessing a client with acute blood loss following trauma. Which assessment finding is most consistent with early hypovolemic shock? Correct answer is C. Cool, clammy skin with delayed capillary refill. Rationale: in early hypovolemic shock, sympathetic nervous system activation causes peripheral vasoconstriction, resulting in cool, clammy skin, delayed capillary refill, and tachycardia. Hypotension is a late finding. A client with myasthenia gravis receiving pyridostigmine is admitted with increasing weakness. Which assessment finding most strongly indicates a myasthenic crisis rather than a cholinergic crisis? Correct answer is C. Severe dyspnea with inability to lift the head or count past 5. Rationale: myasthenic crisis results from insufficient acetylcholine at the neuromuscular junction, causing profound skeletal muscle weakness, especially of the respiratory muscles. Severe dyspnea, inability to hold up the head, or inability to speak in full sentences indicates impending respiratory failure and requires immediate ventilatory support. The other options reflect cholinergic crisis, which presents with muscarinic symptoms such as excessive secretions, bradycardia, diarrhea, and muscle twitching. A client with end-stage liver cirrhosis is admitted with confusion, slurred speech, and a positive hysterexis. Laboratory results show an elevated serum ammonia level. Which provider order should the nurse anticipate and prioritize? Correct answer is C. Oral lactulose titrated to 2 to 3 soft stools per day. Rationale: hepatic encephalopathy results from elevated ammonia levels due to impaired liver detoxification. Lactulose lowers serum ammonia by converting it into ammonium in the gut and promoting excretion through the stool. Titration to 2 to 3 soft stools daily indicates effective therapy. Diuretics and beta blockers address complications of cirrhosis but do not treat acute encephalopathy. A nurse is evaluating a client hospitalized with acute pancreatitis. Which assessment finding best indicates that the client's condition is improving? Correct answer is C. Serum amylase and lipase returning to normal levels. Rationale: in acute pancreatitis, inflammation causes elevated pancreatic enzymes. Resolution of inflammation is reflected by normalization of serum amylase and lipase. Hypocalcemia, ongoing pain, and absent bowel sounds indicate continued disease activity or complications and do not signal improvement. A nurse is caring for 4 clients. Which client should the nurse assess first? Correct answer is D. Client with acute confusion in serum sodium of 118 milliequivalents per liter. Rationale: severe hyponatremia, less than 120 milliequivalents per liter, can cause cerebral edema, seizures, and coma. Acute neurological changes indicate an immediate life-threatening condition requiring priority intervention. A postoperative client suddenly becomes restless, tachycardic, and hypotensive. The nurse suspects a pulmonary embolism. What is the priority action? Correct answer is C. Administer high-flow oxygen. Rationale: airway and breathing take priority. High-flow oxygen improves tissue oxygenation while further diagnostics and treatments are initiated.